Out on the campaign trail, we have Chelsea Clinton saying that marijuana essentially can kill you. So let's just go with we have three different articles that we're going to look at here. We'll start with marijuana.com, Tom Angel, and we'll just read him up. The former and possible future first daughter of the United States acknowledges that marijuana has medical value, but she also seems to believe that cannabis use can lead to death. Anecdotally, she says, we have lots of evidence in epilepsy, but also in autism and stimulating appetite for people who are on intensive chemotherapy regimens, for people who have non-epilepsy seizure disorders and challenges. This is what she said on Saturday. Quote, but we also have anecdotal evidence now from Colorado where some of the people who were taking marijuana for those purposes, the coroner believes, after they died, there was drug interactions with other things they were taking. So let's break that down. Essentially, she's saying that, sure, marijuana, we've seen, anecdotally just means it looks like that people are using this and it works. There's no studies to back it up, but it looks like it's doing what they say it's doing. So anecdotally, we have evidence that it works. But she says there's also anecdotal evidence that that there are some deaths, and that these deaths were caused by marijuana interacting with other drugs, other things that they were taking perhaps for these other conditions. Well, there's so much wrong with this. I don't even know where to begin, but we're gonna go with what everybody else said. But the one thing I don't know if anybody mentioned all this, but there's nobody. She can't actually point to some actual doctors in Colorado and say these are the actual cases where the people that died. She's talking about coroners. Like, she actually talked to some coroners around town, and they were like, oh, the coroner believes, that's her quote, that there was drug interactions with other things that they were taking. Not true. For sure, not true. Definitely. But she doesn't produce these coroners or the patients that died or what their conditions were or what their other drugs that they were taking, the possible interactions and side effects of those drugs. But one thing we do know is what we know about marijuana. So let's go on. She was answering a question about her mother's position on marijuana rescheduling during an appearance before a group of students at Youngstown State, Ohio, or Youngstown State University in Ohio. The Clinton campaign did not respond to marijuana.com's request for clarification about what the candidate's daughter was referring to, and implying that marijuana use has been tied to deaths apparently caused by its interaction with other drugs. So that's one source that says no comment returned. Okay, so but while candidate Clinton has said that she is 100% in favor of medical uses for marijuana, Chelsea implied that she wants cannabis to go through the Food and Drug Administration approval process, which she called the gold standard for the world. Even though the agency has approved a number of drugs that have proved to be very dangerous and deadly, addictive. These are the same people that approved PCP when it was accidentally discovered in the lab. And it took them almost a decade before realizing that they really have no use for that crap. So, what do you mean? We already have tons of studies, by the way, we'll get to that later. Alright, quote, we just need so much more data than we have so that people who might benefit have the chance to benefit. People who might be in danger are protected, she said, quote, so absolutely my mom supports strongly the need for more rigorous study and then subjecting it, as we do kind of everything else that might have a medical purpose, to FDA approval, scrutiny, and ultimately regulation. Nothing could be farther from the truth, because we already have plenty of research saying that cannabis is medicine In fact, if you want to look at specific things that it cures, just type the ailment and then cannabinoids, and you'll find plenty of papers, research on that. Many subjects, many ailments, ranging from like, oh, I don't know, chronic pain all the way up to Alzheimer's disease and other debilitating conditions. All right, her mother has promised that if elected, she will reclassify marijuana to Schedule 2 from its current status under Schedule 1, which was the most restrictive category. Now, Schedule 2 just hands it off to the FDA because they have to, now you're talking about the FDA having to approve it for medicine. Okay. Last month, the DEA, Drug Enforcement Administration, was acting on a recommendation from the FDA to deny the long pending petitions to reschedule cannabis, of course. It has been suggested that Clinton's struggled outreach to millennial voters could be strengthened by endorsing marijuana legalization. Young people overwhelmingly support ending cannabis prohibition, and polls show that a sizable chunk are now supporting Libertarian Party candidate Gary Johnson and the Green Party's Jill Stein, both of whom have made marijuana law reform centerpieces of their campaigns. All right, so here's some more reasons why marijuana advocates are criticizing Chelsea Clinton. And this is from attn.com, a great up-and-comer. You should check out their articles. All right, for one, there have never been any documented cases of fatal marijuana overdoses. And that includes deaths resulting from interactions between marijuana and other drugs. In fact, as Attention previously reported, researchers have found that when combined with prescription drugs such as opiate-based painkillers, marijuana enhances the effects in a positive way. Quote, cannabinoids can synergize with certain medications such as opiates to actually increase the analgesic or pain-relieving effects of the drug. Dr. Michelle Ross, a cannabis researcher and founder of the Impact Network in Denver, Colorado, told ATTN on Tuesday. What it doesn't seem to synergize with is the side effect of the drugs. So, for example, whereas opiates can depress your breathing, slow it down, cannabis will not enhance that. The second problem with Clinton's claim that it characterizes existing research into marijuana medical benefits as anecdotal. This is similar to the way her mother has described marijuana research on the campaign trail, calling for increased research into the medicinal or medical properties of cannabis while seemingly denying the growing body of scientific literature on the subject. Maybe it's they're out of touch, maybe it's that they want to ignore for a reason the research that's out there, but quote, there have been over 20,000 studies published on PubMed, a federal database of biomedical research, Dr. Ross said. This is not anecdotal, quote. This plant has been researched more than Tylenol and more than Adderall, more than any other medication. That's true. That's just the 20,000 published on PubMed. You can find an additional 120,000 if you just look at, if you go to a Google search and do peer-reviewed studies on cannabinoids or even THC, you'll find a plethora of studies on THC alone. But cannabinoids will net you hundreds of thousands of studies and peer-reviewed papers, which are also studies for all the purposes. It's probably one of the most studied plants / medicines in the history of the world. I mean, opium and opiates are not really that studied, to be honest. There's not a whole lot written about them. They want to bury the history on the opium wars and whatnot. And opium and its derivatives aren't really written about other than in fictional stories and, you know, sensationalized. There's not really a whole lot there, writing material. Alright, so anyway, advocates worry that her daughter's comments can have unintended effect on public perceptions of cannabis at a time when legalization efforts are ongoing throughout the U.S. Yeah, I mean, I thought you guys were the progressives over there. It sounds like you're trying to scare somebody with some old reefer madness. Anyone who has experience with marijuana or is even vaguely familiar with the research knows that cannabis has never led to an overdose death in recorded history, says Tom Angel, founder of the Marijuana Majority, a nonpartisan organization advocating for marijuana reform. Quote, Chelsea Clinton has a huge platform, and I hope she will take the opportunity to quickly correct the record. ATTN also reached out to the Clinton campaign for clarification on the comment, but a representative was not immediately available. We will update this story when we receive a response, they say. And then Snopes, the internet online fact checkers or whatever you want to call them, you know, like they basically go after stuff that goes wildfire on the internet and, you know, possibly or most of the time ain't true. We've seen them be in the tank for Hillary, quite frankly. So, you know, while we're on this story, I don't think they gave her the in the tank treatment on this one, but basically from Snopes, who also couldn't get clarification from the HRC campaign, says without clarification from Clinton, it is virtually impossible to determine what purported incidents she was citing. Several high-profile deaths have occurred in Colorado in which families claim marijuana was a contributing factor, but not as part of drugs interaction. Moreover, these deaths largely involve recreational, not medicinal use of cannabis. So here's a quick excerpt from some stories about that. Another death in Colorado has been listed as having marijuana intoxication as a factor, according to a KCNC investigation, and several other families are now saying they believe the deaths of their loved ones can be traced to recreational marijuana. Daniel Juarez, an 18-year-old from Brighton, died September 26, 2012 after stabbing himself 20 times. In an autopsy report that had never made it public before but was obtained by KCNC, his THC level, the active ingredient marijuana, was measured at 38.2 nanograms. In Colorado, anything over 5 nanograms is considered impaired for driving. That shouldn't be a thing. Up till now, just 3 other deaths in Colorado were seen as having links to marijuana. Levi Thamba Pangi, a 19-year-old college student, jumped from a Denver balcony to his death in 2014 after eating marijuana edibles. Marijuana intoxication was listed as a factor in his death. Richard Kirk of Denver is accused of killing his wife Christine. Before her death, she called police and said her husband seemed to be hallucinating after ingesting marijuana edibles and prescription medication. And finally, a college student, Luke Goodman, killed himself in Keystone in March shortly after ingesting marijuana edibles. You see a pattern here? I mean, 3 of them were suicides straight out of the bat, and then the 4th one was a murder, an alleged murder. We don't know if that's been resolved yet, but anyway, none involved have reported an interaction of marijuana with any other substance, as in marijuana didn't, even if it was just, you know, marijuana plus something really toxic like, I don't know, heroin, it didn't kill, that didn't cause them to die. They killed themselves, period. Marijuana did not cause the heart to stop or whatever. I mean, it's just, those have nothing to do with the case studies. So that was crazy that they even mentioned these, but that's what they are. You know, they're people trying to amplify marijuana being some kind of deadly thing, but it just simply ain't. It's never been deadly. It has no deaths connected to it anywhere ever. 3 deaths, okay. So, marijuana is largely believed to have either no adverse effect or a synergistic effect when used in concert with other medications. That's about it for that story. I can't believe that we're here. And what I mean by that is, I used to be kind of like, when a presidential election came along, you had to be on the side of the Democrats, because the Republicans were strict prohibitionists, like your Bush family types, or, you know, even before that, back to Reagan. I'm 44, so I remember, I was a little kid, but I remember Reagan and then the first Bush. I remember the first Bush being awful for marijuana laws, and then Clinton came along, and we all had hope that he would do something, and nothing. Well, you heard it. The Clinton family is stuck in some kind of reefer madness era propaganda state where there's no hope. I mean, the only hope is Schedule 2, which upends almost every medical marijuana law written in the whole country. We don't want Schedule 2. We got enough research. We have plenty of research. We will fight you on that. I know we will. I know we can. If we can't, then we don't have a lobby at all. We're just a bunch of people just that sit back and smoke too much reefer and fall into their reefer madness propaganda stereotypes, which it ain't the case. And I think people that are for marijuana legalization, whether they use marijuana or not, are way ahead of the curve on the information surrounding marijuana. So when somebody, and I mean even the layman or the average citizen these days, if they have anything that sounded a little fishy, they will Google it instantly, so they know right away that that statistic that keeps biting you in the ass, nobody's ever died with marijuana being a cause of death. Period. Get that through your head. It doesn't matter if you mix it with something else, it's still not going to kill you. It's never been proven, and if it has, they would be carting out the examples, putting them in your face, showing you the proof, and telling you that, you know, that they were right all along. When really, what are you talking about? We're thousands of years into the history of marijuana. No one's ever died. You have nothing to prove it's dangerous in any way, shape, or form. So, quit using people like Chelsea Clinton. I mean, you should really look up the video yourself and watch her do this. Watch her say this, because it's you can tell she knows she's lying. You can tell she's being insincere all the way through the whole. I don't know if it's like a minute long or less that she says this stuff. It's terrible. It's terrible to think that we're that stupid this day and age, to listen to that crap, and to think that you can honestly walk out there and make people think that your policies are for the better of the people when they're not. When Schedule 2 is not for the better of the people, it's for the better of your friends who will get rich off of marijuana slow rolling through the FDA process and then getting approved and passed out to the other pharmaceutical family buddies. Like it's just like a free-for-all. And we're not going to let that happen ever in any way, shape, or form. So don't even bother with that.